basically who's hosting this today. Obviously, I want to thank her for hosting it from the Brown County Library. Um, the people that are on this call primarily are from IFMA. It's an International Facility Management Association. We have 3 chapters in this state, one in Madison, one in Milwaukee, and one in northeastern Wisconsin. And every year we usually get together, all 3 chapters, and we have what is called a tri-chapter. And we try to, well, we pick a topic, and then we have speakers coming in from all over. Obviously, this year it was being held in April and at Harley-Davidson in Milwaukee, and that didn't happen. So in talking with the other presidents and other members of our chapters, we thought it would be a great idea because we're facility managers and or associations that cater to them to come together and talk about what are we experiencing, what solutions might we have to offer to help ease into the reopening of our businesses. So that's why we're having this webinar today, and some of the speakers, very great information out here today. So hopefully you can stay for all of it. And again, if you have any further questions or specific questions for any of our speakers, you can most certainly reach out to any of them at any point in time.
All right, well, to lead off with our event today, we have Ryan Wozniak from the Wisconsin Department of Health Services. He is the supervisor of Vector-Borne Respiratory and the Invasive Diseases Unit. And he comes to us with some very current, very up-to-the-minute information on the return to work. So, Ryan, if you would unmute and begin.
Yes, hi. Thank you for having me. Yes, I work at the Department of Health Services in our Bureau of Communicable Diseases. And just last week, we released, in collaboration with the Wisconsin Economic Development Corporation and a number of other partners, some guidance on best practices for returning to work for employers. We have some general guidance, which I can show you in a minute, and then also some different sector-specific guidance that was developed. So our team at the Department of Health Services, it consisted of myself and our Chief Medical Officer in the Bureau of Environmental and Occupational Health, a couple of occupational health epidemiologists, one of which who had worked at OSHA for many years, over 30 years, I believe. And then we also collaborated with an industrial hygienist at the Department of Safety and Professional Services and our colleagues at DATCAP, which is the Department of Agriculture, Trade, and Consumer Protection. They regulate, if you don't know, lots of different businesses, including food, restaurants, tattoo parlors, lodging, recreational businesses as well. So they took a look at some of the sectors specific to the areas that they regulate and provide a comment as well. So we didn't have a long time to put these together, but we feel pretty good about the content, and we can always tweak them over time as conditions change, but we think they are a good set of best practices to start with for everyone. Can I get the ball to show my screen, please? Thank you. Thank you, Kurt. So I'm going to show you the website where these guidance documents or best practices are located. This is the WEDC site, and if you go to their main page, there'll be a link on top for COVID-related resources and information. You click on that, and it'll take you to, I can do that for you, I guess, walk you through maybe. So on here, you have a bunch of different resources, and then if you scroll down a bit on the right side, you'll see guidelines for reopening your business safely.
I don't believe we have your screen yet.
Oh, I'm sorry. Yeah, let me try that again.
Third button from the left on the bottom.
Oh, yes, I'm sorry. Okay, do you see it now?
Yes, we do.
Great, thank you.
Thanks.
So I'll kind of go back a second here. So yeah, on the top of at the WEDC.org website, there's a red bar, and there's a link there to COVID-19 related kind of resources and information. If you go to that site and scroll down a bit, there's different resources, but on the right side here, you'll see guidelines for reopening your business safely. And if you click on that, it'll take you to this page on our reopen guidelines. And if you scroll down here, we have a number of different documents. We have some general guidelines that apply to kind of all businesses. And then we also have some sector-specific documents for about 10 or 11, I think, different sectors: agriculture, construction, as you can see, entertainment and amusement, gyms and fitness centers, hair and nail salons, hospitality and lodging, manufacturing, outdoor gatherings, outdoor recreation, professional services, which are more kind of office environments, and public facilities, restaurants, retail, and transportation, and then also warehouse and wholesale trade. So a number of documents here. Hopefully these are of use. As I mentioned, these are based on the current conditions and current situation, so they may be tweaked a bit over the coming months, but I think they're a good starting point, hopefully, for all those. I mean, some of these sectors have already been open and operating, and some are just coming online now in terms of like maybe the retail sectors yesterday, and then others will be coming, in the coming weeks, so or sooner. So I could open up one of these just to give you a quick overview of the general layout. This is the professional services guidelines. So this is for offices, office settings, commercial office spaces, for example. So there's just some, background information here, and then so different sections on, social distancing and some recommendations on that in these settings, and employee health and hygiene, use of face masks and cloth face coverings, different engineering controls and disinfection and cleaning procedures, kind of how to maybe control movement within the facility to reduce interactions, break room guidance, and then just general stuff on employee training for the kind of new realities that we're in, and some other support communication information. With regard to this particular sector, because this is one of those sectors that can probably most easily, in many cases, be done remotely. Our recommendation is that professional services and office sectors, including our agency, we're going to continue to try to work remotely to the extent that we can, until we pass through more phases of the Badger bounce back plan and some of the gating criteria there. And we are making good progress on those, but we're not quite there yet to where we feel comfortable having everybody go back to work as normal. So for those who can work from home, for these office type settings, we are recommending it. Now we have additional guidance this is for manufacturing. And obviously manufacturing is a more difficult environment, obviously, remotely, and it's, impossible in most cases, except for maybe some administrative folks who work in more of the office setting. But we have additional guidance here, which will hopefully be useful. Manufacturing, there's a wide array of settings, and different types of manufacturing facilities. And we had to be fairly general here. We just don't have the bandwidth to create guidance for every specific manufacturing industry. So these are, fairly basic and standard, but hopefully they will be of some use as you kind of go through reevaluating your operations and trying to make it as safe as possible during this time. And then, like I said, we've got the guidance documents for a number of other sectors as well. So those are our reopening guidance documents. And I thought, we are seeing outbreaks in, congregate settings throughout the state, in various food processing plants. You've probably heard about some of those in the news. Trying to get to another. And, there are concerns, obviously, when we have people in close settings working together. And it's kind of a illustrative exercise, and to give you an idea of kind of what, how this virus can be transmitted in an office environment, for example, or, and this is kind of a worst case scenario. This is a call center. This is a study that came out recently in the Journal of Emerging Infectious Diseases, which is published by the Centers for Disease Control and Prevention. This study was conducted by Korea's Centers for Disease Control and Prevention. They looked at an outbreak that occurred in a call center, and this is admittedly a very crowded kind of office environment, so it's not typical, I think, of most of the environments that you all probably have and work in, but it does, like I said, illustrate some of the concerns and the potential for spread. So in this office, this was in late February, early March. They had a large outbreak of COVID-19, and I can show you. This is called the epidemic curve. So we see the dates at which people became ill, their onset of their symptoms, pretty rapidly saw a few cases in late February, and then a big spike over the course of about a week in early March. And they eventually had to close the building because of the outbreak. And most of the folks were located on this 11th floor. They had a few other folks scattered about on the 9th and 10th floors, but for the most part, this outbreak was contained at 11th floor. And if I go back for a sec here, and here's the layout of this particular call center. And like I said, I think most of our office settings, we have generally cubicles or offices and things like that to provide some separation. That was not the case here, but it does give you some indication of how the virus can spread quickly amongst coworkers who aren't social distancing and don't have barrier protections or other kind of PPE. So if you see here, this is a layout of the floor plan of the call center. I can give you a little bit of orientation here. This is one of the call center banks here on the top. In the spots in blue, there are locations where the workers who were tested or were tested positive for COVID-19. And then there's another area to the south where there was another call bank, a little smaller one, where only a handful of people were tested positive. And so most of this is pretty well closed off from this area. There is some interaction. Here is a hallway to some elevators, and then there's some stairwells. There is a men's restroom on this side and a women's restroom on this side. So there was some limited interaction between these areas, but not prolonged. But as you can see, the vast majority of cases were all on the same side. So even though you might have folks on this side, for example, females who were going over to the other side to use the restroom, or males on this side going over to use the restroom on the other side, the folks, the spread of this illness was largely confined to the area where the initial case, we assume, was located here, and where you had more prolonged exposure. So, it is a factor of, having the virus present, but also the duration of exposure and the frequency of exposure. And the folks who, were on this side were more exposed for longer periods of time. These folks may have been exposed for short periods of time as they went to the restroom, or they may have been exposed through, shared surfaces such as, elevator buttons or restroom handles or things of that nature. But it was much less, there's much less spread, at least at this point in the outbreak before they closed the building down, than there was on this side. So it just gives you kind of an idea of how quickly these things can spread if precautions aren't taken to protect against that. So, and like I said, I don't assume that most of our settings are quite this crowded, but just to give you an idea of how quickly these things can spread. So hopefully that is, gives you a better kind of indication of how quickly these things can move around in work settings. And like I said, we have had our share of outbreaks in facilities in Wisconsin already, mostly in, like I said, food processing plants, in terms of work environments, but also other kind of congregate care settings. So this virus is very contagious, and there are steps that can be taken, to minimize our risks. But if not taken, we can have large outbreaks like this very quickly. So that's kind of like I said, the resources we have created. Hopefully, you all will take a look at those. If you have any feedback for us, please let us know. And I'll be happy to take questions now or at the end, or whatever's most convenient.
Well, so far we actually have not had any questions come up in the chat. So if you have any other details or information you'd like to share, please do so.
Or if we have questions from other panelists.
Hello, can you hear me? This is Brett Heigla, President of Southeastern Wisconsin Chapter.
Yes, hello.
Hey, how's it going? Definitely a lot of information here. Is there any, as you mentioned, this office is denser than most offices. Is there any guidance from the CDC on what the sweet spot is in the density setting? Because there's a lot of talk by a lot of my clients of phasing in office space. Is there guidance as to what that level looks like, and besides a 6-foot distance, or maybe that is it?
Yeah, that's a good question. There's so much variability between different buildings and different office settings. It's hard to come up with kind of one-size-fits-all guidance. But The 6-foot distance is recommended in at least, and more if possible. Barriers like cue balls and things are effective, although aerosols can obviously go over them, to coworkers that are on the other side. If you sneeze or cough and things like that. And so we, obviously recommend face masks for those who are going to be working. It doesn't capture all the aerosols that are expelled by somebody during coughing, breathing, sneezing, but it does capture and reduce the amount that are in the environment. We do recommend in our guidance, as if you go through that, to limit as much as possible meetings, in-person meetings in rooms. And if you do have to have meetings in person, choose the largest room possible and spread out as much as possible. I think ventilation is a very important aspect of this, and I'm not an HVAC professional, but increasing the amount of fresh air. Where we've seen some of these outbreaks occur in other large facilities, it's been when there's more stagnant air and not a lot of air movement. We don't see a lot of outbreaks associated with like outdoor activities, for example. So the recommendation currently is to increase the amount of outdoor air you can get in through the system and the number of air changes per hour to the extent that's practicable, and to work with your HVAC professionals or maintenance and building facility folks to try to increase that to the extent that you can. And as I said, also face masks will help. And working, allowing some folks to work from home to minimize the amount of folks that are in the building would be recommended as well. And to the extent that you can, and I think those are all good steps to try to. But as far as like a specific distance, I would say at least 6 feet, and hopefully, we can. There's room to spread out even more if possible. But the other measures, face masks and increased ventilation, and reduction of meetings and things like that, where I put people in close contact, is advised. And limiting visitors to the extent that's possible. I know we have meetings with our partners and our clients and customers and things like that, on a typical basis. But to the extent that those can be done remotely, it would be advised at this time. If you do have to have visitors come over, we do recommend that you keep a log of those that do come, so that if there is a need on the road, due to a positive case, either among one of your visitors or among one of your coworkers, it's easier to do contact tracing that way for folks who may have been in the building at the time when the person may have been infected, or infectious, I should say. Does that answer your question?
Yeah, thank you.
Sure. Ryan, we have had another question come in on chat. So that question is, must we stay at least 6 feet away from walkways then as well?
You mean while on a walkway, or?
Or if your location of where you work happens to be next to a walkway.
Yeah, I would recommend, if there is a walkway, say you're working on a assembly line and there's a walkway behind you, having that distance be at least 6 feet longer would be advised. If you're wearing, depending on the job, if you happen to be wearing an N95, which is proper PPE that has been fit tested and you've been medically evaluated to wear, those are more protective, and we still would recommend 6 feet, but you could potentially make it a little bit less if you're wearing that proper PPE and as well as eye protection goggles or face shield. But I would, in general, yes, at least 6 feet. In order to cut down on interactions between people in hallways and things of that nature, if possible, we recommend maybe making a one-way path through your facilities. Either going clockwise or counterclockwise, in a loop around the facility, so that people aren't necessarily passing as often. That's not as much of a concern because the duration of exposure is very low if you're just passing by somebody. But nonetheless, it couldn't hurt to institute that if it's not too much of a burden on your processes. Another thing, when it comes to walkways and pathways through buildings, to the extent possible, having doors open. That can pose a security concern in certain areas, so that has to be considered. But if you can have doors that are open, so you don't have to be touching the doors or door handles, or having automatic doors that can open, without touching, that's another recommendation to try to minimize potential exposures.
Thank you. And I guess one question that occurs to me, but I may, pardon my attention has been a little kind of fragmented, trying to field emails coming in from attendees who are trying to get in and other such things. But
Sure.
you may have already addressed this, but as the return to normal sort of continues, I know you have kind of a staged process planned. Have you provided kind of best case scenario, tentative guidelines as to over the weeks, how many weeks will be spent at what levels and how many weeks at another, or is it just too soon to tell?
Yeah, hopefully you can see we have a Badger bounce back page on our website. It's really hard to predict. It really depends on these different gating criteria. But we do have like this dashboard. It's going to be, I think, improving over time. We're always trying to make it look better and be easier to visualize for our citizens. So here's a list of the things that we're looking for to move into different phases. Currently, we're looking, to have sufficient capacity at our hospitals and downward trajectory of influenza-like illness and COVID-like syndrome cases and positive tests as a percent of the total tests within a 14-day period. So, and then downward trends in cases among healthcare workers. So those are as you can see, we did finally, I think just today or yesterday, hit this mark for the downward trajectory of positive cases as a percent of total tests within a 14-day period. But we're still not seeing the downward trend that we'd like to see among healthcare workers and in general in symptomatic people who have flu or COVID-like symptoms. So, and then also we have some other core requirements, they're called, in terms of having sufficient PPE for all those that need it, having sufficient testing capacity, which we actually have met now. So we are there for that. And then also contact tracing. I don't know if people are familiar with what the term contact tracing means, but whenever we have a positive case, then we interview that person to identify all the people that they may have come into close contact with during their infectious period. And we have to notify those people that they have been in contact with somebody who has tested positive and that they should quarantine for 14 days. So to really stop the spread of this effectively, we have to have sufficient contact tracers to deal with all of these positive cases. And we have thousands of positive cases now. And, for example, an outbreak at a certain facility could result in a couple hundred cases in the course of a couple of days. And that takes an enormous amount of staff to do the proper contact tracing for an outbreak like that. So we're building up. We're trying to hire, I think, 500 contact tracers, and we're in the process of doing that as we speak. But that is another capacity that we really need to get to where we feel comfortable opening things up to a greater degree than we have.
I do have another question that has come in, and then just a note. Sometimes your voice gets a little quiet, so it's a little hard to hear on the. So
I'm sorry. Is this better?
I think that might help, but we did have another question come in from the chat. We have several people who disregard social distancing and refuse to wear masks. Also, regarding masks, the discomfort and steaming of eyeglasses is creating a barrier to acceptance. And so can you have some suggestions to address that?
Sure. Can you hear me well now? Is this better?
I think so.
Okay. With regard to the wearing of face masks, and social distancing and things of that nature, we can't really enforce those things on the general public. But in the workplace, the employers have the right to, and they have the requirement, at this point, to require people to take the proper precautions as laid out in the stay-at-home order. Once the stay-at-home order expires or is overturned, we still will have some sort of recommendations, obviously, that employers enforce to help keep the workforce safe. With regard to masks and fogging, I understand that is an issue in some cases. Certain types of masks have a better seal, and they do have less leakage around the outside. Those would be N95s. And there are some that have an exhalation valve that at the front of the mask that, from what I hear, helps with that issue of fogging with glasses and things of that nature. So, it would be best to wear a tighter fitting mask with an exhalation valve, and make sure that the mask, if you are wearing an N95, it has to be fit tested properly to make sure that you're getting a good seal, and that requires being clean shaven for men, and other issues that can. So if you have a beard and you're wearing a mask, it's not really providing the protection it should be, and you're going to get more leakage outside the edges of the mask, and which will cause fogging in glasses and things like that.
A follow-up question to the N95 with the exhalation valve. Just curious, would that still actually be protective of those around the person wearing that mask because of that valve?
Yeah, it just makes it easier. As you're wearing a mask, you're taking air in and breathing air out, and a lot of the aerosols are being kept on the inside and outside surfaces. But the valve itself is, well, yeah, to be honest, I guess that's a good point. It does, the valve only goes out, so some of the air that is exhaled would go through that valve, and I guess wouldn't necessarily be caught by the fibers in the mask itself.
Thanks for that clarification. Oh, Ryan, I think we might have lost you. I think we lost connection with Ryan.
I can work on that and monitor. Oh, I think he's back.
In the interim, looks like
we can continue with the next portion of the agenda.
yeah, let's do that. Scott, if you're ready, I believe that would be you. So Scott Wollenzine, past IFMA, Southeast Wisconsin IFMA chapter president and facility manager for Northwestern Mutual in Milwaukee. You want to share with us parts of or what you would like to of the plan?
Sure.
We do have Ryan back,
Thank you,
though.
Lois. Can you hear me?
Yes.
Did you say you had Ryan back?
Yeah.
I'm sorry, did I cut out there?
Yeah, we lost you for a minute or two.
Oh, I'm very sorry. Yeah, I noticed my my VPN disconnected and then reconnected. So I don't know where I was when I was.
I think we were just finishing up a discussion of the masks with the ventilation valve.
I think that it was a good point. I think that those masks do protect you. They do give off a little bit of your respiration, that isn't necessarily caught by the mask. So that is a valid point. Increasing, I think, ventilation, like I said, and also maybe putting in some physical barriers between folks who have to work closely together, so that maybe they don't have to wear as much respiratory protection. Would help with A, the fogging issue, and B, be less of a concern that they're exhaling potentially virus into the atmosphere. So those would be kind of, I guess, recommendations on that
point. Thanks. I guess that finishes up all the questions we have in the chat. Does anyone else have a question at this time? If not, I guess we can probably, or anything else you want to add yet, Ryan?
Nope, I think that's it for me. Thank you very much.
Okay, well, thank you very much for your time. We do greatly appreciate it. I'm sure you're in high demand at this time. So, without further ado, sorry, Scott, back to you.
All right. Thank you, Lois. Are you able to hear me okay?
Yes.
Yeah. Terrific. So good afternoon, everybody. Appreciate the time on our call today. So I thought it would be helpful to understand from a large corporate type setting and Thank you very much, Ryan, for giving us the overview you did from a state of Wisconsin perspective. And to your earlier point about the WEDC site and some of those different industry-specific recommendations, I've been able to read most of those and am finding those very, very helpful for us. And so just I would highly recommend those on the phone. Take a look at those, and they're very helpful guides in some of the things that they're recommending we do to come back to work. So, and it's not so much come back to work because I think we're all been working very hard even at home. So it's more of a return to the campus type perspective for Northwestern Mutual team. And for those that don't know, we have a campus setting that's a split campus between the Milwaukee campus, the Franklin campus, and we also have an air operations facility. And all in, it's about 3.5 million square feet of office space. We have about 6,000 people. So you can imagine that a lot of questions have been tossed our way from a facilities management and facility operations perspective about, okay, what's next? When do we come back to work? So basically hanging on our every word. And so we're anxiously absorbing all the information such as those helpful guides as well as looking at other large company type return to operations playbooks. And so from our perspective, some of the things that we're thinking about, of course, is the social distancing. Of course, is people's safety. Safety is number one. And before anything else can happen, we're considering people's safety. So we haven't obligated people to wear masks. It's still up to them, but we probably see a small percentage of people here at the campus that are working yet having masks and some that do not. We have, out of 6,000 people, just to give people a perspective, about 98% of our staff is working from home. So it leaves just a couple of hundred people that are here day in and day out maintaining the facilities. And so that's where I'd like to focus today, is in maintaining the facilities. So some of the things that have to continue from a facility operations perspective, of course, is good maintenance to help provide the highest levels of safety and operation to the equipment. A lot of it right now is shut down, so we're saving lots of money in energy, which is terrific. And we have a skeleton crew from an electrical, mechanical, and technical perspective that are here helping some of the 24/7 operations that still occur, like in our health clinics, as well as with some of our new policy and new business processing that's happening. So, you know, we're using this time wisely in taking care of PMs, preventative maintenance items that we wouldn't otherwise maybe get to as easily without a business disruption. We've taken care of a number of different operations that might require a shutdown. So from an electrical perspective, we're maintaining those systems while offices are shut down and things along those lines. I mentioned people's safety, right? So not only face masks, but social distancing. What are we to expect when we're coming back to work? So several things are in play there right now. Nothing is set in stone because it's also fluid as to when we're allowed to come back. But we are planning on things like arrows and dots and social type cues out there to help people as they navigate the building, come back to work. We're looking at workplace solutions and workplace planning in separating people at their desks, maybe going every other desk. Maybe for those that are benching, we're going to be using some germ guards, the plastic plexiglass guards that maybe you've seen at the grocers, considering obviously face masks, face guards, gloves is going to be paramount. And then, excuse me, also looking at our food services operation in terms of, as many of you know, we have a large cafeteria spaces at our facilities. So what do we do with those? At least on the onset, self-serve is basically gone by the wayside, And we're going to look at more prepackaged type items, queuing people into the space, maybe pick up a bag lunch or a box lunch to help with that social distancing aspect. And then from the health clinic perspective, we have social distancing that are taking place down there. Those still continue to operate Monday through Friday. We have halted from a meetings perspective and those types of things, events perspective. We have basically ceased all events and meetings up until the end of June at this point. June 30th would be the soonest we would come back and do a large meeting type setting. Of course, paying attention to the guidelines set forth by Ryan and his team. So what are we focused in on moving forward? We're focused in on enhancing our cleaning efforts. So a lot of the things that are in those guides that Ryan mentioned, we have already in play in terms of high touch areas, the elevator buttons, the horizontal surfaces, all the handles, restrooms, all of those types of things. From a cleaning perspective, we're actually hiring a couple more staff potentially to just focus on those items during the day. We want to be able to portray that it smells clean, it looks clean, and that people are actively cleaning. So we want to give people that confidence that those extra measures are in place. We're also looking at a number of tools so that people don't have to touch the elevator buttons, the call buttons in the hallway, or the car buttons on the inside. And we're actually going to limit the passengers on each of the elevators to just two people only, and to the point where we're going to educate our staff. Some of that will have to be self-managed, but we will have people that are actively monitoring the facility and people operating within the facility to make sure that those suggestions are being followed. So a lot of things at play. We are actually, when you consider all those things individually, what is the total plan, right? So employees, I mentioned at the beginning of my discussion, employees are anxiously waiting to hear, when am I coming back, or when am I able to come back? And we as a team are operating a lot of different, our different divisions, the security team, the restaurant team, obviously FAC Ops, safety. The safety team is a huge part of my team. Workplace solutions and workplace planning is a huge part. And then finance is also a big part, right? Because whatever we're going to do in addition to where we were at one time earlier this year is probably going to have some type of budget impacts to it as well. So understanding, you know, when I say large scale, understanding that a lot of these pieces, of course, can make their own plans and make their plans in terms of where they want their cleaning standards and where they want labor applied, what they want to do in terms of change management and so forth. And with a large organization like ours and our department, the decisions that I'm making are going to have impacts on the restaurant, or they're going to have impacts on the way people operate within the facility, right? So I thought it would be a good idea, and we've just formed it, is basically a return to work team, if you will, that is represented by the 14 different areas that I mentioned. And they're the leadership, and we're going to be making decisions that then they'll take back to their teams from a communications perspective. And then all the decisions that we're making are being recorded so that we can come up with an actual playbook that we can then post out to the other employees that have yet to return to work, helping provide that level of safety and confidence so that they know exactly what conditions will be like when they return, and any questions that they have can be quickly answered so that there are no surprises when they get back to work. And don't get me wrong, I'm not anticipating all 6,000 people coming back to work immediately. Everybody will have varying degrees of wanting to come back to work and feel comfortable here at work. So we're empathizing with that as well, and understand that some people either they have childcare to consider, or they're just simply not comfortable and they prefer to work at home going forward. And that's fine too. So we understand that there's going to be variability within how quickly people are returning to work. So, so communication is going to be a big thing. External communications, I mentioned. Internal communications, so those that have a team of people, helping them become aware and familiar and confident with the plans that you are making, because all of those individuals can then become ambassadors when the employees do come back to work. So if they're stopped in the hallway or they are looking to ask one of my team members a question, they can feel confident in what the answers are. So those are some of the things. I went through that fairly quickly. I'm not sure exactly how much time I was allotted, but happy to answer any questions that you may have going from that perspective.
Well, thanks, Scott. We've had a few come in, and one of the ones that came in, I think that was intended for Ryan to talk about, but you sort of addressed as well, was the idea of capacity on elevators and how best to address that, and guidelines and recommendations. And I know that you said you're going with no more than 2. I don't know, Ryan, if you'd care to jump back in and if there's any other thoughts from the state's perspective.
Yeah, I mean, to the extent that's practicable, we would recommend, I guess it probably depends on the size of the elevator to some extent. If it's a larger elevator, we could get, people in, if there's 6 feet distance in if you could all be in different corners of the elevator, you can maybe get 4 people in there max. I would say, I did see some recommendations from CDC to limit, elevators to 1 person at a time. If that's possible, that would be, ideal, but we understand with large workforces that may not be possible. Using stairs instead, is another option that would be a bit safer. But it also depends too, are you wearing any respiratory protection while you're in there? If you are, then you might be able to get 1 or 2, maybe 3 people in an elevator at a time. But if you're not wearing any respiratory protection and the elevator isn't very large, I wouldn't recommend more than 1 or 2 at a time, probably.
And sometimes asking people to go up a high-rise tower is a little bit more difficult, so you're forced into using the elevators. We're also going to designate stairwells up and down. And then one of the other things I didn't mention in my discussion, but one of the things that for anybody that's had a building sit for any length of time, you may want to consider, and that is because the water stagnates in the pipes, you may not get this at home so much as in your facilities. And in our facilities, by and large, the buildings have been vacant for 7-8 weeks now. So one of the considerations that we're learning about is you will want to flush your pipes, basically, drinking fountains, ice makers, all your production equipment in the restaurant, etc. And then maybe think about doing some Legionella and lead testing as well. So what we're reading and what we're learning from our folks is that with the stagnation of the water, bacteria can obviously set in and settle, and you want to make sure that water gets either chlorinated or treated, or at the very least flushed for a certain length of time until it becomes safe again.
And I'm assuming you'd be happy to share your sources for how-tos, maybe even if it's a service you contract to do so, that kind of thing?
Be happy to answer any questions. So
great.
This is Ryan. Sorry to chime in again, but I think that's a great point, Scott. And we do have a little bullet or 2 about that in our general guidance for return to work, and there's a link in there to CDC has some guidance specifically about Legionella, but Scott makes a good point too about other heavy metals that could be present in the plumbing that could build up to higher levels than normal after sitting for so long. There are these water management companies that work with lodging facilities and other large buildings like hospitals to maintain their water quality and to test it regularly and things like that. So that's an option if you have a large building to work with one of those water management companies.
One other related question that came up to the elevator discussion was what kind of tools are you considering for pressing elevator buttons to, of course, limit that major point of repeat contact?
That's a great point. You can either use your access card to hit the button, or they actually make tools out there, I'm learning. It's a plastic utensil, basically, you keep on your key ring that you're able to touch the buttons with. I wouldn't recommend using your metal key on those plastic buttons. You'll wear the numbers off, but so I'd be happy to share the link out to the group if you'd like, one that we're considering.
That would be great. It occurs to me that maybe even a simple pen or pencil, as long as you're not, you know, constantly touching the
So your
end of it.
skin's not touching it. Right.
Yes. Okay. And one other question that has come up, and this might be a question probably for Ryan. Can the virus be transmitted by ingestion?
No, we don't see any evidence of that. I mean, there are obviously foodborne diseases out there that can survive in the acidic environment of the stomach, but there's no evidence that this particular virus can be transmitted through food. If you had a contaminated container, for example, that could, or utensils or things like that, that then you used and then you were touching your nose or something of that nature, then it could be transmitted that way, but not through the stomach, no.
Okay. At this point, if there are no other questions, and Scott, if you have nothing else for us, I guess we are prepared to move on to the next portion.
Thank you very much, everybody. Appreciate it.
Thank you, Scott. Thank you very much. It's been great. Oh, wait, one more quick question, sorry. We are handing out Q-tips and popsicle sticks for common touch points that employees can toss after use. That's a comment that came in. Would that be a possible recommended approach?
I love the Q-tip idea. Very soft, right? Doesn't harm the finishes. It would be great. So that's a great idea. I didn't think of that one.
All right, so then I guess that brings us up back to Ms. Patty Ann Hendrickson. Patty?
All right. Kurt, do you have me on so I can share a screen? Kurt?
You have the ball, Patty.
I do. All right. Excellent. Okay. Again, Patty Hendrickson. I am a vice president for Mid-American Building Services. I'm from the northeastern Wisconsin area. We have our main headquarters is in Milwaukee, and we have a branch also in Madison. Basically, what I want to touch on quickly is I'm going to show you, as soon as I can get there, just a sample specification for your janitorial companies. Undoubtedly have a cleaning spec. What we want to do is add on the disinfecting portion of it, and there are many, many schools of thought out there as to how that can happen. I'll tell you, there's foggers, there's electrostatic sprayers. There are many different companies that have fabulous disinfectant products where you can spray and wipe. There is a new situation coming on board, which is going to be ultraviolet light, and that I find that to be incredibly fascinating. So I will share this with you. Let me grab this up here right now. There we go. So again, hopefully y'all can see that. I attached the WEDC guidelines if you want that link. And then I also have this link attached to for building graphics, et cetera, from ARC. They have some fabulous things that you can use for your buildings.
Patty, the document is not displaying. It's displaying as a gray screen.
Huh. I wonder why that would be.
The previous document you had up was displaying, so you may have dragged a panel onto the screen that you're not sharing.
Ah. Because I'm a really good sharer, you know.
If you can unshare and reshare, sometimes that's the simplest way to.
Of course, my technology is going to be. Okay. All right. Okay, you know what, guys? I'll just add it on later. It's just the link to ARC and also some sample specifications for janitorial cleaning and disinfecting. Most of your companies, I'm sure, have the technology to do that. Also, like I said, I added an article from a NASA scientist, and it's talking about fighting the coronavirus with ultraviolet light. Very fascinating article. I'm monitoring that quite closely because they are now using that for entryways. So when you walk through the portal, more or less, it's going to disinfect. Lighting fixtures. The FDA has not approved it yet, but there are manufacturers that are actually developing this. So that's exciting to me. It's like, oh my gosh, that would be so helpful to all of us. But there again, being in the cleaning industry, I'm sure most of you are aware that you have got to not just clean but disinfect as well, and your cleaning company should be able to help you with whatever technology they have for you. So.
And thanks, Patty. Are there any questions relating to cleaning? I have not received any, but I'm sure that this is going to be the $1,000, $64,000, $1 million question. So Ryan, I don't know if you have anything specific. Are there guidelines that if a facility manager is looking to vet a cleaning company that you would recommend them referring to for guidance as to how to put these requests out?
No, we don't really have like a certification or anything, at the state level for cleaning companies, if that's what you're asking, where we can kind of vet these entities. We do, in terms of, disinfectants that are effective, and other detergents are very effective against this virus. It's not we have some viruses and bacteria that are very hard to kill. This one is not one of those, but also EPA does have a list of disinfectants on their website that are effective against SARS-CoV-2, which is the virus that causes COVID-19. So, but yeah, in terms of companies that to do this work and that are that we can trust, I don't have a list of those now, unfortunately.
And I can get that information to anyone that would need that. I noticed a comment too about using the difference between quats and disinfectants. Bleach is not a recommend. It's sure it's a disinfectant, but there's so many surfaces out there in our buildings that you just do not want to put bleach on them. So check with your janitorial services, and if you don't have one, my information's out there. I'll be happy to talk to anybody further about what kind of disinfectants would be useful. Also, note to the people that are coming back to work, we've got to make sure that they're aware of how to protect themselves and other people that they're working around. Bringing in hand sanitizers. And I know a lot of these disinfecting wipes and the like are hard to purchase right now, but it's going to get better. We will have these things, I'm hoping, by the time most of us open up. So, it's taking care of each other. I think that's very key. But your janitorial company should be doing the disinfectant step after they clean now. That's going to be very key. It's the new norm.
One question that just popped up, that this may be for you more so, Patty, maybe Ryan, but one question was cell phone cleaning, because of course those are tools that employers provided as well as ubiquitous in everybody's hands and used as access devices, et cetera. So
right.
Any thoughts on that?
Absolutely, especially cell phones, even your computers, laptops, those are touched primarily by a specific person. And it's the onus is on them to take care of that, to disinfect it. So it's the employer should be supplying them with the disinfectant wipes to do that. But even in general cleaning, in my 20 plus years as a building services contractor, we leave that up to the employees to take care of their own personal stuff. So if it's their own personal cell phones, their work cell phones, their work computers, anything that they personally have control of, they should seriously be monitoring that and making sure it's disinfected. Does that make sense?
Yeah, I know it probably would be helpful to be able to provide employees with guidelines as to how to do that safely, so as to not damage the equipment. Especially, I'm sure, in case some of them take matters into their own hands and if they're sharing equipment across shifts, I
Right.
imagine you might have some very particular people getting the wrong things out to clean shared computers, other shared technology. So Patty, maybe Scott, thoughts on that? To keep them from wrecking your stuff?
Yeah, there are, just certain electronics that you can't just spray with
No.
ethanol or something. There are particular wipes for different electronics that have been approved. I know this came up during the elections for some of the those that had electronic voting options. They couldn't spray those down and wipe them. They had to use specific wipes. I believe they were 70% isopropanol, but it may vary depending on the type of equipment. The last thing I saw for recommendations was to check with your manufacturer. And
Right.
yeah, but I think that it would probably be pretty standard for most cell phones. Whatever worked on, say, an iPhone, would probably also be fine for a Samsung or whatever.
Yep.
I don't have any specific guidance, but I think it's out there. If you look around on the internet and also at the different manufacturers' sites, they should have guidance on that, I think. But yeah, if these products aren't being shared, it's less of a concern. But like you said, if there are shared cell phones and other communications devices, they should be disinfected between users, obviously. So.
Yep.
Yeah, from Northwestern Mutual perspective, we are considering there's UV light sanitizers for cell phones, so we're considering a couple of those in our common areas. We've considered room UV lighting, for lack of a better term, machines, but those get rather pricey, and they're only good for about a 6x8 area, so you're going to need multiples of those. We've also looked at overhead UV lighting, like for our walkways and things like that, to your earlier point, Patty, about trying to sanitize the air as it gets recirculated or as people are coming into the facility. So we're looking at all of those options right now.
That's great.
As well as in air handlers, UV lighting in our air handlers as well. So you can check with your local filter folks. Filtration Concepts is who we use for our UV lighting in our air handlers.
This is Brett with Southeastern Wisconsin chapter. Question, I think probably for Ryan on this. I've heard some different opinions on thermometer checks at front desk. Some companies are doing more of a questionnaire type survey to employees, and some are doing the temperature checks. There's concern if there's an actual physical person doing that, that could put them at risk. Any thoughts on that or input?
Yeah, there are a lot of different options for screening employees. You can actually take physical temperatures either with a thermometer, which would require somebody to have, PPE that is, or a team of people that are screening people coming in. Depending on the size of your workforce, that might not be practical. There are these touchless infrared thermometers that can be used on people's foreheads. They're not, my understanding is they're not easy to get right now, and in some cases they're not really that accurate. That may not be as useful. Then there's others. They're just asking their employees subjectively to monitor their symptoms and to take their temperatures at home before they come in and to report those accurately. Depending on your workforce, and we have worked with some populations that are nervous to tell their employers about whether or not they're sick because they don't want to be fired or something of that nature. So that it kind of depends on your situation and how many employees you have and what their interactions are going to be. There are ways. I think there's some apps too that you can collect information on people and their symptoms on a daily basis, or ask them to submit a daily survey of their symptoms prior to coming to work. But yeah, in terms of doing on-site screening, there are some recommendations from CDC on their website. They have a FAQ for employers, and there are 3 options that they list for doing on-site screening, and it covers those things I just talked about for the most part. Is either doing it from a distance with a thermal thermometer or the infrared thermometer, or some kind of a barrier between you and the person, a physical barrier. Then you could pass a thermometer with a cover on it to an employee through a window, for example, is another option, or just asking your employees, sorry, to take their own temperatures at home and report those to you.
All right, I guess we have one more follow-up question on disinfecting, and then I'll want to get us moved on to our next presenter, if that's okay. From our attendees, I understand some vaporous disinfectants use silver as a catalyst, and that can harm electronics. Comment, but possibly also a question. I don't know if anybody can address that.
That's beyond my reach. I'm not familiar with that. I'm sorry.
Okay.
Yeah, I would just say,
Okay.
I mean, that certainly could be the case. I'm not familiar with that either, but it's something to keep in mind, I guess, as you look for
Certainly.
disinfectants that can be used appropriately on your electronic equipment.
Okay, so then thank you, Patty, for your time and your contributions. Well, I see that your screen is up sharing some of your information, so that can be part of what we supply to all attendees. But to give Josh Lowe from Akita Box his time and his due, so founder of Akita Box, so just to keep it brief, I'll let you take it away. Thanks, Josh.
Thank you, and thanks for having me. This is a rather interesting time. I personally like talking in front of crowds as opposed to at my computer screen in my basement of my house. But we'll be back there soon. It's been an interesting journey for the last few months now, trying to figure out what new normal looks like. Look, we all want to be back in our office. We were over 60 strong downtown Madison, eating out of food carts every day. Boy, we miss that, especially in the summer. And so we want to get back there too. So it was an interesting transition. We are a very young company in general, and that transition of working out of our houses off of Zoom, to be honest, felt seamless. From a workforce impact standpoint and a productivity standpoint, I feel like we were lucky. We almost felt zero impact, and in fact, I think it empowered many of us to figure out how can we help. How do we use that extra time we have? Me personally, before all this happened, I was on at least 4 planes every week in some other part of the country, and being at home for this long honestly feels super strange. And we want to get back there. And so we figured out as a group, what could we do to have the biggest impact potentially to help us get back there? And so we quickly developed on top of our existing software platform what we call Deep Clean Assurance. And this isn't a tool, to Scott's point, to help you touch the elevator button. It's not that tactical tool. What we're really after and trying to impact that we see a huge gap for here is trust, right? And getting people to trust the fact that it's safe to come back, that we're doing everything we can. I think we're very good as facilities folks to sit in a room and talk about all the things that we're trying to do to keep our employees in our building safe. And sometimes it doesn't get communicated out as clearly as we would like it to. And so trying to develop a tool that is clear and standardizes the cleaning processes. So we just talked a lot about cleaning, and there's a lot of questions around cleaning. And what our tool does is actually looks at the updated list of CDC and EPA guidelines. We're constantly looking at that to make sure that it's there, and then making sure that not only alongside that, but the checklist that they're going through to do the cleaning is per the CDC and EPA guidelines. And then it also gives them the list of all the cleaning materials that right now are approved in their state to kill coronavirus, and how long that the dwell time is supposed to be. I'll be honest, I found out way too much about the cleaning process and cleaning products over the last few weeks. And one of the things I personally learned is I use cleaning products completely wrong. I was probably never killing anything with Lysol in my house at all before this, because I wasn't letting it sit on the surface for 5 to 10 minutes wet. And so making sure that, we're also appropriately compensating our cleaning folks, right? That was a big wake-up call when we talked to the folks who clean our building, and we started to talk about all the things that needed to be done, and we realized that, yeah, we were keeping a pretty clean building, but because we never had to worry about disinfecting, the amount of hours and minutes that it adds in every room and across your buildings is tremendous. And so making sure that we're laying out the expectation for everybody involved that, you know, the new normal is going to mean cleaning costs more than it ever has before. But that cost will have a direct impact on getting people back to work, on getting our students back to school, and getting the economy going again. And so for us, it's important, it's vital to get something out there in the marketplace to start at least pushing us back towards normal. We just talked about temperature taking. I used to be a technologist in the construction industry, and talking to some of my friends there, they now already have robots rolled out to take your temperature so that you don't have to have a individualized person and it's capping and disinfecting itself all in the same kind of swipe. So the amount of innovation that's happening right now is tremendous. How we all use that innovation, or how, frankly, it ends up either being required, demanded, or just implied and expected, right, of people coming back. That's, I think, the unknown right now. What we do know is that people want to come back, but we have a lot of conversations with, for instance, higher ed, right? It's not the 18, 19-year-old kid you need to convince that they can go back to the dorms and get back to campus life. It's the parent who's footing the bill. And so how do we as institutions, as groups, right, if we keep that parent in our mind of the person ultimately that needs to feel comfortable leaving their kid at school so that they can even go to work, that's what we really need to start asking ourselves, and putting the tools and the innovation in place that's going to provide that level of trust and care for everybody who walks into our buildings. You know, with that, threw a lot out there, not meaning this to be a sales pitch of a Keto Box by any means, much more of a conversation around our collective issue of getting back to work. And if there's any questions, I mean, we have conversations with people all over the country. We've probably heard it all to this point as far as questions go, and happy to share any insights we've gathered, at least to date, from what we're hearing from people.
At this point so far, I don't have any specific questions that came in other than one I missed sort of on the last one. My apologies for that. As far as the practicality of testing and temperature taking with a malady that may not show symptoms for 14 days. And I don't know, that, I guess, is that good enough? Is there another approach or an additional thing that should be considered in employee screening other than self-reporting and temperature taking?
This is Ryan again. So yeah, that is, you know, one of the problems is that folks are shedding virus while they are, you know, pre-symptomatic, or even if they're asymptomatic. So, you know, temperature checks are good. They do can weed out folks who are actively ill, but those who have mild illness or no obvious illness or are pre-symptomatic can also pose a concern to the workforce. That's one of the reasons why we recommend, obviously, the wearing of masks and things like that in the workplace, and increasing ventilation and keeping social distance, because yes, it's not just those people who are obviously ill that are shedding. It's in some cases too, we find that the folks that are shedding the most are those that are just in that period just prior to them developing symptoms. So we've seen these kind of super spreading events. It's been people who hadn't yet become ill, you know, became ill later, but then they were spreading in the community for a couple of days prior to their illness manifesting itself. So. yeah, that's why the other, screening is good, but it's not a foolproof plan to eliminate illness in the workplace.
Thank you, Ryan. So, Josh, I know that so far we haven't had any specific questions come in. Is there any area that you've been found that has kind of stood out in your conversations with companies across the country where that's sort of the primary hot button issue for reoccupying facilities and?
Yeah, I mean, yeah, ultimately it comes down to a lot of the things that we're talking about, right? And it depends on where you're at. That's the other big thing that we've learned. I live out in, my house is in rural Wisconsin. Most of the buildings, go to downtown Baraboo. It's a different type of a landscape of what reopening looks like and limiting businesses to 6 people. A lot of those shops could only fit 6 people to begin with. Versus we have clients like Aramark in downtown Philadelphia in high-rise buildings that, before all of this happened, where their elevators were basically made to create efficiencies in moving people, to put as many people on a single elevator as possible. And now they're having to look at reverse engineering that to do the exact opposite. So it really differs on where you're at as to what your approach is and how they're even looking at the possibility of reopening, which has been, I hate to call anything coming out of this interesting, but that's been a little intriguing to me of how this is truly very different for different people.
Definitely. So I'm assuming that your field of work include everything all the way through higher ed, government, education, healthcare, corporate, institutional, hospitality, et cetera?
Yeah, we do work for the federal government and all the way down to K through 12 and higher ed, and then anything in between. So a little bit of manufacturing and a lot of healthcare. And initially we came out of this trying to help our partners in healthcare understand the space they have and maximize that space. I think that was all done successfully for the most part around the country, even of getting that capacity up. Those tools are no longer needed, and now our focus is really back towards the rest of society, not so much healthcare. And how do we get these other businesses, who have kids, my kids are eating the bandwidth right now, which is why I can't show my video on my screen, getting them all back out and interacting and those types of things. So that's been our focus. But it has been very different conversations, state to state, and county to county, even within Wisconsin. So we're here to help. If anybody has any questions as far as different strategies different folks are taking, happy to throw things out there. But it has truly been across the board. But lots of innovation. I think that's the cool thing to see in all this is that I think as people are locked in their basements and away from their coworkers, they're all putting their heads together and using their brains at peak capacity in order to get back out of their houses again.
Okay. All right. Well, thank you very much for your contribution, Josh. We really appreciate your time. And at this point, we'll move on to our final presenter, Ted Blyfus. Ted, to give you as much time as possible in our 8 remaining minutes, take it away. Oh, go ahead.
And what I'm trying to do is help businesses develop business continuity plans. And I'm currently working with 4 businesses, small businesses, but they each have their own, like building a house, have their own plan. It's got to be customized. And the first part was really planning and preparing them for the pandemic. And now I'm working with them as far as planning and preparing for them reopening into the workplace with their employees. So it's a little bit different, but it's still, I'm doing it more, from a corporate view. What are all some of the things to consider? And I'll just run by these. I know we got a little short period of time left, but again, you still have to have a communication strategy, how you're going to be communicating to your employees, to your clients, to your vendors, as far as when you're going to be coming back. Your workforce, again, most of your workforce is probably working remotely. You're going to have to decide, who is going to be coming back and what processes are you going to have, because processes probably now may have changed because of all the different types of situations regarding clients wanting products and services. Your HR policies, those were drafted for the phase 1. Now you're going to have to take a look at what policies probably have to be revised for employees coming back into your office. Critical one that's really, again, outside your control is your supply chain and vendors. Before you can decide, coming back, it's critical. You need to know what state are they in from an operations standpoint, because they're going to be providing you the products and services. So it's critical that you're working with them and determining, do they have the inventory, do they have the products and supplies for you to actually come back into work. IT technology, there you're going to be looking at, what's needed for IT support back to the company. Also, you're going to be checking with some of your personnel regarding what are the assets. They may have taken some of the PCs with them, making sure they get those assets back to the company. Again, like I said, critical process and services, there may have been some revisions, and those are going to have to be, again, modified and changed to fit the new environment. Key employees, you've defined what your critical services are, critical functions are, and you also defined before who your critical employees are. And hopefully in phase 1, depending upon the activities that people had to do, there was some time to actually cross-train some of your key people in the event they would get sick. Again, it's another thing to consider coming back into the office. And another item is after action report. From phase 1, there's a lot of lessons learned, and hopefully someone within your organization is able to determine exactly what are some changes we need to consider going forward. And specifically, people are assigned some responsibilities and specific target date, so those things can be identified. And the last thing is, even though we're going into, let's say, the next phase of recovery, there should be some planning and strategy put forth to say, what happens if the next wave would happen to hit us? There should be, again, a plan in place just in case, the virus will hit us in the fall. So again, these are just some of the things that I try to work with the 4 different clients I am right now. I'm looking at their playbook. I'm looking at some of their best practices that they plan on implementing, and I'm just trying to identify specific risks to them for when they come back into work. I know that was fast, Lois, but that's hopefully there's any questions.
That was wonderful, Ted. Thank you. I don't see that we have any on the chat at the moment. Do any of our panelists have a question for Ted on this? Or I guess we could also maybe, heaven forbid, talk about that potential second wave. And maybe, Ryan, you can also speak to, not that we want to be negative, but it does behoove us to be prepared.
Sure. Yeah, it does kind of remain to be seen going forward how, we don't really have any indications at this point that the virus is as affected by warm weather as say, influenza. And, the decreases we've seen in cases to this point are, probably almost solely attributable to our to our staying at home and our social distancing efforts, not necessarily due to warmer weather. We still see lots of cases in states like Florida, and the southern part of the U.S. that is much warmer than here and is at temperatures that we would see in the summertime in Wisconsin that would normally cause a decrease in the infectivity of an influenza virus is not necessarily what we're seeing with this particular virus. So I do think, as we open up, we are going to, likely see some, increase in cases. Our hope is that we have sufficient contact tracing and lab capacity and healthcare improvements and treatments and things of that nature that will allow us to better handle these cases as they come up and to control the spread when we do see them, identify them more quickly, and prevent additional exposures through this enhanced contact tracing. I think it's at this point it's going to be a while, I think, until we have sufficient herd immunity through either a vaccine or just exposures in the public to where we can kind of get back to normal and without taking the precautions we're having to take now. I think those will be in place, for many, many months to come. There are some viruses over time. There's evidence that they do mutate to a less infectious form that enhances their survival. If viruses kill their host, they aren't spread as much. So it is to the advantage of the virus, and over time, there's pressure on it to maintain its survival, to become a little less severe in the symptoms that it causes, so that it can affect more people and be spread by more people. So that's one thing that could, down the road, ease up a bit on some of the severe effects and deaths that we're seeing now. But that it's hard to predict those types of things, obviously.
So Ted, would you say that you're probably preparing your clients for these kinds of months and months of plans?
Right. I'm having weekly meetings with each company, and as we're just going through the different phases, and then again, I try to give them some things to consider and how they're going to implement it. And but we're going to continue having weekly meetings and going through each stage, because each company is going to have a different, let's call it reopening. This nonprofit company that helps cancer survivors, they're not going to be having their employees come back until July, if then. Landscaping company, they're having their employees come back a lot sooner because a lot of their services are outside. They can control a lot more. So every company, again, is really customized and a little bit different, and each have to determine, when is it going to be safe for their employees. So it's going to vary, again, for each company, what's the best approach? Can we, should we, and when will we be able to reopen?
Thank you, Ted. I think that wraps it up. Just one really quick question. If Ryan, if you can answer, one of our attendees would like to know where to find the case study of the call center that you mentioned that you shared.
Yeah, that is, the address is going to be too complicated to read out to you, but if you go to, if you Google Emerging Infectious Diseases Journal, you will be able to find that. It's at CDC's website. You could also do a simple search, I think, for, if you just said, coronavirus call center study, South Korea, you'll find it
Okay.
as well. But it's been published in the Journal of Emerging Infectious Diseases.
Okay.
I can give you, it's volume 26, number 8.
I'd say that probably should help Google find anything. Well, I guess, thank you, everyone. I see we're at just over our time limit, but Patty, if you have any final words you wanted to say to wrap up, but I want to apologize for the technical difficulties we had with the link sending out, and thanks to everybody for their patience.
Patty had to get off with her technical difficulties, but thanks everyone for showing up and participating. And everyone, wash your hands, stay 6 feet away, wear a mask, be safe, don't touch your face.